Hello, we're back for another time. I have a lot of stuff on my mind, but I'm not going to say everything I want. But I will tell you that tomorrow is March 1st, and March 1st is Yellow Shirt Day. I'm so excited. I have my yellow ribbon on. But for those of you who don't know what Yellow Shirt Day, it's pretty much our kickoff. There have been discussions about whether Endometriosis Awareness Month is real, and it has been appealed to the United States policymakers to make March National Endometriosis Awareness Month. It is Women's History Month, which is also pretty amazing from my perspective. But we're really trying to get the whole month and not just a Yellow Shirt Day or even just a week. We'd love the whole month to continue to educate and bring awareness to the issue. But for now, March 1st, wear your yellow shirt. If you don't have a yellow shirt, you wear a yellow dress, you wear a yellow belt, you wear a pashmina, you wear a yellow headband if you have it. Whatever you have, support. So yeah, I'm really excited about that. That's not really what I'm messaging today. Today, I wanted to talk about the effects of cold weather on not even just endometriosis, but people with chronic pain in general. So I have an old ankle injury from dancing, and I fractured my ankle when I was in like third grade, and then again and again and again. And it hasn't bothered me in years, but I'm here and I'm walking around in the cold, and of course I had to buy an ankle brace because my ankle gets so tight, and I couldn't quite figure it out until yesterday when I walked outside into the snow. And even today I was walking in the rain, and it felt like a knife was just cutting across my stomach, just going deep into my ovary and slicing it. And that's not a comfortable feeling. As you can imagine, it's quite painful. And so I'm really thinking about how cold weather plays into healing. And so I did some research, and the findings are saying that cold weather doesn't affect healing, and cold weather has no influence on how much pain you have. But really think about it. Why do so many people move to Florida, older people, move to Florida after they retire? Because it's warm and it's easier. Your joints feel better when you're in warmth. And that's just, in my opinion, that just makes sense. So I'm up here. I live in New England now, and I'm having a really hard time with this cold weather. And so I don't know. I really think it needs to be addressed more. And I know a lot of people who have had who have endometriosis and live in the north, and I can't tell if their healing is different than those who live in the south. I'm not sure yet, and I really want to look into it because it's bothering me a lot. It hurts so much more in the cold, and it hurts a lot more now than it did when I first moved here. And so I don't know. I just really think it does have something to do with it. I also realized that of my 5 surgeries, I believe 4 were in the winter, between December and February. And so that may explain a lot about why I may not have healed correctly, or may explain why I kept getting as much scar tissue. Because if you think about, I don't know, I had a friend who just broke her foot or her ankle, and she had to leave. She had went back to live with her family in Florida for a few weeks because being in Boston, she had a cast on for weeks and was not healing. And so we really think that the weather played a part into that. So I really want to see if women who have surgery in the winter are more susceptible to pain than women who have surgery in the summertime or the springtime, or even where you live, because I know there's a big endometriosis population in Australia. And is their healing any different than that of women who are in Northern Europe and women who are in Northern US? Well, Northern North America, I'll say. So I'm just really curious about that, and it's bothering me that everything I'm looking up is telling me that there's no effect. And it's not just endometriosis pain. This is women with arthritis, women with fibromyalgia, all these people with chronic pain. How is their healing different by the season? And I also know that it has a lot to do with emotional health in the season. We tend not to be as excited about life when it's gloomy and snowing and raining like it is right now. And so really how does the emotional health play into the physical health? And there's just so many connections and so many things that need to be addressed within that aspect. So yeah, I'm going to look into that. I may have to give you guys a part 2 of it. I had something else to say, but I can't remember. I don't know. Oh, I did. I wanted to give some feedback. So I've been getting a lot of really great responses, and some people saying that I was inspiring to them or just thank you for educating them. But I realized I never really educated anyone on what endometriosis is. I pretty much gave my perspective and how it feels, but I didn't say scientifically this is this and that is that and this is what happens. So briefly, endometriosis is a disease that occurs in women, starts in the female reproductive tract. Layman's terms, how I explain it is when you get your period, you get it on the inside and the outside. That's kind of how I explain it. It's not the best way to explain it. The best way to explain it is pretty much that the tissue that is found inside your uterus is found outside of your uterus, meaning the blood isn't exiting the body, and so it's ending up outside. This is your uterus. It's ending up on the outsides of your uterus. It's ending up on your ovaries. It's ending up on the fallopian tube, and sometimes it's even ending up on your rectum and your bladder. And so that's problematic, very painful. That's why a lot of women are experiencing painful bowel movements, and so that's often misinterpreted as irritable bowel syndrome when it's not. A lot of women experience it on their bladder and eventually develop, let me not mispronounce this, interstitial cystitis, I believe. IC is what I call it. But so there's other complications that come along with it. So the disease can be blotches, it can be bigger ones, and it can be localized to one area. So yes, that's just some background. I once had surgery where the uterus is here, and the endometriosis had become so massive on the left-hand side that my uterus had tilted and turned 45-degree angle. And then I also had another time when my ovary, so this is ovary, fallopian tube, the ovary was like bound behind the back of my uterus. And so, because it's not just the disease that's the issue, but it's also the scar tissue and the adhesions that kind of web everything together and make it extremely painful and uncomfortable. Just imagine having your hands tied behind your back all the time. And that's kind of how it is. And so the ovaries and the fallopian tubes aren't flowing as freely as they should be. So yeah, just wanted to give a little background. But it's very easy just to Google it and look up some good sites. I highly recommend the Endometriosis Research Center, endometriosis.org or endofoundation.org. All of them have great information on it. I mean, WebMD has great information too, but I'm just giving you some more base ones, especially, how could I forget, the Center for Endometriosis Care has great information, great articles about what it means to have endometriosis, how it affects your family, your partner specifically, different things that come along with it. I have other topics I can't wait to discuss, but they touch on a lot of on cysts, they touch on adenomyosis, which is something I'll discuss in a later vlog. Just so much, and they're really good at touching on this. So there's a lot of articles under patient library, I believe, or something like that. So yeah, so centerforendo.com, I'm believing. So yeah, not much to say on that, but just wanted to give you guys some background. So remember, Yellow Shirt Day is tomorrow, March 1st. What else did I say? Cold affects pain, whether they want to believe it or not. And third, what endo is and pretty much how it works. So I hope it was helpful. I tried not to be as long today. I did really well, 9 minutes. Okay, talk to you guys later. And if you're looking for me, at me, acupdcaked. I'm tweeting a whole lot about the amazingness of women's health. Thanks. Bye.